pleasant good afternoon to you folks. If you're just joining us, this is Static Point Weekend. My name is Marcus James. A little break in between for you, a little balance in between to bring you information that we know vital to you and your family. And joining me right now is Dr. Winkfield from Mass General. Welcome to the program, Doctor.
Thank you so much, Marcus. It's really nice to be back.
Yeah, and we really appreciate you taking the time to spend it with us. And we know how important these topics are, and this is just the first in a series that we're going to be doing. And these topics are from folks who are out in the community, and they said, Marcus, let's talk about certain things. And the thyroid is one of them. Let's talk about the thyroid. Doctor, what is the thyroid?
Yeah, it's interesting. I was going to ask you the question, so I'm glad you kind of gave me a little bit of insight in terms of where this question about the thyroid came from. The thyroid is actually a little gland that sits in the front of your neck. For men, and hopefully there aren't too many women who have Adam's apples out there, but if you just feel just below your Adam's apple, there's a gland that sits there. It's actually not able to be felt in most people unless it's slightly enlarged, but it's an important gland because it's an organ that actually helps to regulate our metabolism, growth as, people are developing, and also it helps to regulate your body temperature. So it actually has lots of very important functions in the body.
And I know that I'm looking at some of the different ailments that can actually affect the thyroid. And I'm looking at 1, 2, 3, 4, 5, 6 of them. And one of them is hypothyroidism. And that one comes up a lot, hyper and hypothyroidism. Can you explain that for us, Doctor?
Sure. So again, most glands in the body are regulated not just by what's kind of going on around that organ, but also there's a system where the brain, there's an organ in the brain called the pituitary that actually releases different chemicals that help to stimulate those organs to give function. And so hyperthyroid is essentially where the thyroid levels, and again, we can draw those levels from blood tests, the thyroid levels are slightly high. Hypothyroid is when those levels are low. And either of those could cause problems. There's a disease called Graves' disease, Graves, which is when your thyroid is producing too much hormone. And one of the classic symptoms or signs of that is people who have eyes that look like they're bulging out. But it can also cause extreme weight loss. It could cause dry skin, etc. Same thing with hypothyroidism. If you have too little thyroid hormone, as I mentioned, it kind of helps with your metabolism. People who are hypothyroid can actually be overweight. They could feel very tired and sluggish. And so it's really important to make sure that thyroid hormone level stays exactly where it should be.
So they have to have, so it's you don't want it too high and you don't want it too low.
That's right.
And the big question is about the thyroid. How do you maintain the thyroid? In other words, we're told for our hearts we want to exercise and we want to eat less greasy foods. How do we maintain the thyroid itself to make sure it stays within that balance?
Yeah, that's a great question. I think, the primary thing is that some of the thyroid function is really out of our control. But it's really important, I think, just to maintain a healthy lifestyle. And that goes probably across the board for any, body organ or system where we're trying to think about health and wellness. If you have a healthy lifestyle, and what does that mean? Well, just having a well-balanced diet that keeps you within a certain caloric intake. You don't want to have too many calories because that you're, not burning off, because then that leads to being overweight. You don't want to have too few calories because then that leads to being underweight. And then the thyroid has to kind of try to compensate for that. And so what's important is kind of trying to figure out what's the best kind of, meal plan, if you will, for your body type and style, and that can be discussed with your physician. The other thing that's really important is making sure that you're having good exercise, and whether that could be just taking a walk for 30 minutes a day or so, but trying to get some exercise in is important. One of the things that's for other countries, less so in the United States, is making sure you have iodine in your diet. And the thyroid actually takes up iodine, and that iodine is important for making the hormone that it releases, the thyroid hormones. And so in some countries, they don't have iodinized salt, right? So we have salt in our country or seafoods that carry the iodine. Other countries might not have that, and so people who do not have enough iodine in their diet can actually have hypothyroidism or low thyroid levels. But again, that's less common in the United States.
That's where that iodine question comes in. Doctor, stay with us. We're going to take a quick little break, and I'll come back to you, and we'll talk about this iodine, because one of the listeners wanted me to mention wanted us to talk about the iodine a little bit more. So stay with us, Doctor. We'll be back in just a minute.
Okay.
Tell them step down, step down, step down. Make way for the